This event today is the Healthy Heart for Women Symposium. It is a big institutional commitment from the NIH and American Heart to raise awareness about cardiovascular risk in women. So we want to replicate this at the University of Kentucky by bringing to the table ongoing research, therapies, and development.
Our symposium, Healthy Heart for Women, is bringing together outstanding scientists from different universities to talk and to address new scientific advance, but as well translational aspect that the cardiovascular field can explore. Our symposium is focused on sex difference because sex difference exists and it's very important to understanding underlying mechanism to offer better and more adapted treatment, and I think it's going to make a huge difference in terms of human health outcome.
I think it's quite amazing that we have these two very innovative junior faculty members who spearheaded this here at the University of Kentucky, Analia and Frederic, and it's now in its fourth year, and they pretty much did it from their grassroots just dedication to the effort. So please join me in thanking them for doing this for us.
Here at the University of Kentucky, we are incredibly fortunate to have two pioneering women in the cardiovascular field in leadership positions. The Vice President for Research, Dr. Lisa Cassis, who has led the field around how people develop aneurysms, and Dean Donna Arnett, who heads public health and is a former president of the American Heart Association. They provide phenomenal role models for all of us as women in the cardiovascular field. That said, there are areas where we really could use more women. So when we look at cardiology, so women physicians who manage heart conditions, when we look at cardiac surgeons, women who practice surgery on the heart, we are woefully lacking. Role models like Dr. Cassis and Dean Arnett in those high visibility positions really does help increase the pipeline of women thinking about medicine and science as a career.
90% or more of us have one or more risk factors for heart disease. And women have a higher lifetime risk of stroke than men. And I think most importantly, and the reason that I have such passion around maintaining health, particularly related to cardiovascular disease, is that 80% of the heart attacks and strokes that exist today could be prevented by lifestyle changes and control of risk factors.
This is a meeting about the heart of women, and diabetes is the single most important factor that eliminates the female protection against heart disease compared to men. If you look at the large randomized controlled trials that have looked at the effect of estrogens in menopausal women, the protection against diabetes is the second most powerful effect after the prevention of bone loss, osteoporosis.
When we think about how a woman's body functions, she has the capability of getting pregnant and carrying a baby to term, and her body and cardiovascular system must adapt to that. And that ability to adapt really puts her at different risk for cardiovascular disease compared to men. I was interested in studying the cells that line the blood vessels, called the endothelium, and we know that hormones affect those cells. So we started studying estrogen and how estrogen affects the blood vessels, and the blood vessels are a key part of development of atherosclerosis and cardiovascular disease. And I came to realize that we knew so little about the cardiovascular system of women that it became very important for me to advocate that research be done for women to understand their specific risk and reduce their burden of disease as they age.
I'm interested in how humans age and how the physiological changes that occur with aging. What happens is that men and women age differently. And these differences, even if we're studying this in healthy men and women, have implications for future risk of disease. And so I thought that was very fascinating that you could take a healthy person and evaluate some of these responses to stress and how blood pressure changes to those stresses, and that might be indicative of future risk 10 years, 20 years later.
So when I speak with my patients about the things that they can do to improve their heart health, I talk about the Simple 7 from the American Heart Association. So that is maintain ideal blood pressure, watch your cholesterol. Maintain an ideal body weight. Be sure that you're getting regular physical activity. Ideally, that's 30 minutes of rigorous, vigorous activity each day. Watch your blood sugar levels. Watch what you're eating. And really in Kentucky, probably most importantly, because it is the most preventable cause of heart disease in the country, is not to smoke. And so anything that we can do to help people either quit or prevent them from starting smoking is paramount.